Hi, everybody. It's 11 o'clock. We're going to get started.
Good morning, everyone. My name is Janet Robinson. On behalf of the New England QIN-QIO, welcome to today's webinar, and thank you for your participation in the Nursing Home Quality Care Collaborative. Enrolling in the National Healthcare Safety Network, or NHSN, and reporting the laboratory-identified Clostridium difficile events to your facility will place you in the forefront of infection prevention in long-term care. While preparing the program, Maureen and I determined that splitting the two-page NHSN checklist into two webinars would offer a clearer presentation of the enrollment and setup process and also allow more time for questions. Today, we will cover the 5 steps on the first page of the checklist. Next week, on September 21st, we will review steps 1 through 3 from the second page of the checklist. Subsequent weekly phone calls have been scheduled for additional information and discussions that will reinforce the steps and also allow you to ask specific questions related to where you are in the process. One of these phone calls will focus on the additional item on page 2 of the checklist, and that item says Report to NHSN, and we may convert that to a webinar format if we decide it's more appropriate. Please take note of the names and contact information on this slide. We are also here to assist you on a one-to-one basis, so don't hesitate to call us directly. Before we get started, I'm going to review a few housekeeping items. This call will be recorded for training purposes. I will provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. We will take questions at the end, and I will provide you instructions on how to unmute your line. If you would like, you can pose a question during the presentation, and you can do that in the chat box at the bottom right of your screen. Please make sure to send the questions to all participants so that we can keep up with the incoming questions. It is now my pleasure to turn the webinar over to Maureen Marsella. Her extensive knowledge about the NHSN and willingness to share information and tips make her the ideal person to conduct this training. Maureen?
Thank you, Janet. As Janet discussed a few minutes ago, this checklist is your most important tool. At the top of the slide, you can see where you can click on this link and download and then copy this checklist, which I suggest you should do. On the checklist, in the first 2 boxes, are 2 webinars that we ask you have to do in order to complete this enrollment. The first one is an overview training, and the second one is the enrollment training. This is what we will be going through today. So once we finish today's webinar, you will have completed box 2. You can check that right off and just have to do box 1, the overview training. So moving right along. Enrolling, getting access to NHSN for your long-term care facility. So this training is for any person who wants to register and enroll a long-term care facility in NHSN. Let me stop right here and say, I am going to pretty much read right from these slides simply because they are extremely prescriptive, and you do have to, and I can't stress more, follow step by step. So I know I hate to do this, but I think that it's the best way for all of us to understand. Again, if you have questions, put them into chat, and at the end, we will address all of them. So any person who may be training other individuals in NHSN should also be in the audience. So what are the learning objectives? Define the key personnel roles for the facility enrollment in NHSN. Describe the information needed to enroll a long-term care facility in NHSN. And third, explain the steps of submitting information during the NHSN enrollment process. So who can enroll a facility into NHSN? Anyone in a long-term facility can be given the permission to enroll their facility in NHSN. We find now that usually the person responsible for the NHSN enrollment is someone who oversees the infection prevention program within your facility. So before you start the enrollment process for your facility, decide which of your facility leadership would be the person point of contact for the NHSN enrollment. It may help to have more than one person learn about the NHSN process to provide additional support. This person assigned to the enrollment in NHSN is the NHSN Facility Administrator. So key personnel roles. The NHSN Facility Administrator. That administrator is responsible for NHSN enrollment and any coordination of users doing data collection and reporting for that long-term care facility. This person has the authority within NHSN to add, remove users, manage users' activities, giving them the responsibility of reporting, editing data, analyzing data within that NHSN program. The facility administrator can add, delete, or edit facility data, and they also can nominate or join groups for sharing the data. If the NHSN facility administrator has a change in their position or leaves the facility, he or she can reassign the roles to the NHSN facility administrator to another user. This is another reason why we stress there really should be more than one user in your building. Tips for selecting the facility administrator. You should select someone who already is familiar with infection surveillance and activity in your facility. This may not necessarily be your organization leadership people or anyone from executive leadership. This person may be the director of nurses, assistant director of nurses, staff educator, or even your MDS coordinator, if he or she is familiar with data management and infection prevention. Although only one person in your facility will have the role of NHSN Facility Administrator, consider training a second person on NHSN enrollment, data submission, and all that process so that you won't be left out in the lurch if someone leaves. And it also gives you a second set of hands if someone becomes ill or is out on leave. Other key personnel roles. Within NHSN, you have a long-term care facility contact person who serves as the main point of contact between the CDC and the facility. Often that facility administrator also serves as the NHSN contact person, but it could be someone else. It doesn't have to be the facility administrator. Then you have NHSN users. Now, remember, your facility administrator is also a user. The other staff at the facility can become NHSN users for an enrolled long-term care facility. You just have to appoint them. Activities that the NHSN user can do, known as user rights, are viewing, entering, editing, and analyzing any of your data in NHSN. The NHSN Facility Administrator can add or remove people as the NHSN users come and go from a facility. The NHSN Facility Administrator works with each user to assign user the rights he or she can access in a facility with NHSN data. So this is a guidebook, and if you see at the bottom, there is a link that you can click on, and it will bring you directly to the Facility Administrator Enrollment Guide. It contains instructions and tips which may address other questions about the enrollment process. And I suggest that if you are the facility administrator, you do download this and possibly even make a copy of it for you to have at your elbow. So now we're going to start the enrollment process in a snapshot, and we're going to go through, as Janet said, that first page of the NHSN Facility Enrollment Checklist. So the first step one is training and preparation for the facility. So review the following documents before starting the enrollment process. Being familiar with this material will help you gather all the information you will need for enrolling your facility in NHSN. The main forms and tools you will need to review are included below. That is the checklist, as we told you, was your number one Bible. The second form that you will need, which is in the third row on that checklist, is the facility contact form. That form I suggest you download, print, and fill out in paper format first, as in the third box here, the long-term care annual facility survey. That also is in box 4 on your enrollment checklist. Both of those can be downloaded. either from the link at the bottom of this screen or the link on the NHSN Enrollment Checklist. And then I suggest printing them and doing all of the data collection on paper form first. For any additional information, you will go back to the Facility Administrator Enrollment Guide for that. And again, I'll stress, all of these documents can be downloaded at this link below. So, again, this is the checklist, and it provides you with an estimate of the amount of time each step will take. You must complete all steps and forms in order to become NHSN enrolled user. So I can't stress enough this point. Follow it step by step. It will help you 100%. If you're like me who thinks I can skip a step because I don't have to follow steps, you're totally wrong in this. You have to follow every step by step, and you will be extremely successful and find it extremely easy to enroll in NHSN and for your SAMS cards as well. So, the next form, as I just spoke about before, that you should have downloaded and printed is your facility contact information. This form contains information for the long-term care, about the long-term care and the people coordinating NHSN use. You may need to talk with others in your facility for the data, such as your, we call it a CCN number. It's the CMS certification number for your facility. You may not be familiar with that, but I'm under the impression that all skilled facilities have a CCN number. If you do not have one, then I suggest that you please contact the link below, nhsn@cdc.gov, and then you will receive an enrollment number because you need that in order to proceed with your enrollment. So, what else on the form as you could start to complete this form? The NHSN component. This indicates which components your facility will be using initially. The first one there in the circle here with the red arrow. The first one is select the long-term care facility component, indicated with the arrow. This is the component you will be using to enter any data into NHSN for a long-term care facility for CDI. Remember, long-term facilities can also report into the healthcare personnel safety component to track staff influenza vaccination. And if you want, you can also click off that healthcare personnel safety component if you wish to do that for your facility. But for this particular CDI initiative, it's not necessary. The NHSN facility contact on page 2. Now, you may designate a different point of contact for each of the different components within NHSN. At this point right now, I don't really think you need to do that. You could put your second user in there. You don't have to include an additional person other than your facility administrator, but you may want to because I think most of you are going to use your facility administrator as your point of contact for the long-term care. Unless you're big facilities and it may be administration that it does that. But again, the people have to be included on this contact information if you intend on using them. So, documentation to review. The long-term care annual facility survey. Now, this, as it says, is an annual survey that your facility will complete annually. This form collects information about your long-term care facility and the services that you provide to the residents within your population and your facility. The data submitted should reflect your facility's experience from the previous calendar year. So if you're completing this today, tomorrow, you will be referencing 2015. You may need to talk to others at your facility to answer some of these questions. So that is why I strongly again suggest that you download this and print it and fill it out in paper format first. So the long-term care facility is on page 2. Give yourself time to review and gather the information on this form. The long-term care facility annual survey may get updated from time to time. So please be sure to check for any notices if a new version is released. And trust me, once you get into this process, you will be getting releases from emails from NHSN quite frequently. For additional guidance on completing this document, you can review the table of instructions. So So, preparing your computer to interact with NHSN. As we know, many computers do not interact and they have spam or they have blocks or whatever. So, you may need to change your email and internet security settings to receive communications from NHSN during the enrollment process. And once you change them, I believe you will continue to receive all of the emails. So basically, it's you have to change your settings to not block NHSN at cdc.gov, the PHINTF at cdc.gov, and the spams, no reply at cdc.gov. So, and add as a trusted site the cdc.gov and the verified.com as a trusted site and allow for some top-ups. If you have any problems with this, I suggest that you do ask for the assistance of your IT manager or the IT department. So, we've completed step 1. We're going to move on to step 2. Request to enroll your facility to NHSN. You can link to the registration website from the long-term care facility enrollment page or go to this link at the bottom of this slide. After reviewing the enrollment material, you are ready to begin the enrollment process. Registering your facility includes reading and agreeing to the NHSN rules of behavior, so you would in the red arrow hit agree, and then you provide contact information for the NHSN facility administrator. Then the next page comes up. The NHSN facility administrator completes this form with their name. Check your email address. Use the same email address for all enrollment steps. Now remember this, that's very important. Same email, whatever you put on this form is the email address you use for the rest of your enrollment. And again, you have to have that CCN number, which is usually 6 digits. It's the CMS certification number, or the CDC will provide you with an enrollment number. Then you click Save. Now, a hint, referring to the facility contact information form you filled out earlier. Another thing is the required training are listed on that checklist that I talked to you about, the overview training and the enrollment training. You have to indicate a date that you completed this training. So if you completed it prior to listening to this webinar, then you put that date in, as long as you also completed the overview training. I will tell you that today can be used as the date that you completed the enrollment training, because we will be using the same exact slide. In the NHSN components, remember you always at the bottom of the screen scroll down, because if your screen is like me, I have it in like triple font. You may miss the save, and you have to hit save all the time in NHSN. Next, you will following successful registration, you will immediately receive a welcome to NHSN email. I'm going to change that to maybe not immediately. It looks as though people are getting it within 24, 48, and maybe up to 72 hours. So don't panic. If beyond 72 hours, I would question it, but it's not coming immediately. You have to understand that the NHSN people are now onboarding probably about 1,000 to 2,000 new homes. So when we get down to the crunch time, it always gets like this. It's nothing new that happens with hospitals. They will get you on board, but it will be a little longer process. You will also receive an email invitation to register for SAMHSA Access, which is step 3A, very similar to the following. Be sure to print this invitation, because it has embedded in it your temporary username and password, and you will need that to do the online registration for SAMHSA. So, looks like we've completed step 2. Now we can move on to step 3A. And step 3A involves secure access management, or getting your SAMHSA card. SAMHSA provides secure online access to an exchange of information between the CDC and public health partners. Users receive an invitation to register with the SAMHSA, which provides instructions for registration and identity proofing in order to obtain access to CDC application, including NHSN. During registration, the users set a password which expires every 60 days. I'm going to suggest to you that if you aren't a very frequent user, which I hope that's not going to be because you really should be entering data on a monthly basis, but if one of your other users doesn't go in frequently, give themselves a tickle in their Outlook calendar or your calendars to say, go at least sign into NHSN and make sure that you have an active account, because it's just a pain in the neck to have it reset. And if you do that on a every 60-day basis, you will have a fresh password. The user is also issued an electronic grid card, which adds an additional level of security when logging into the system. The card will be mailed to you at your home address, I believe, because that's what we stress that you use. And that card looks like a credit card, and it has a grid on it. And I believe I can show it to you right here. It's in the middle section. But for your first time registering into SAM, the invitation to register email contains your username and password on that invitation to register. You can get that site by hitting the link at the bottom of this screen. You use the far left login piece because you're going to use your temporary registration and password, which is in the invitation to register email. And that's why we tell you to download it and print it. Then to continue your registration, after accepting the rules of behavior, enter the required registration information and click Submit. And you have now completed 3A registration with the Security Access Management System. Now we'll move on to 3B, Step 3B. Step 3B is identity proofing. After accepting the SAM's rules and behaviors, you will receive an email which contains all the information and documentation for identity verification. Print this email out because it contains the documents which must be completed. Carefully follow the instructions in the email to ensure the enrollment process is not delayed. And I can't stress this again, you have to follow it step by step, or it will not work. So, once your identity documentation has been processed, you will receive confirmation of approval for a SAM's access via email. You will also be issued an electronic grid card, which is used for logging into the system along with your username and password. This will all come in an envelope to you at the address you provide to the SAM's registration. The option to log in using only your username and password only provides you a level 2 security access. In order to get deep into your NHSN data, you need a level 3 access, and that is why you must use your grid card. The electronic grid card will be mailed to you to the address you provided. It says here 3 weeks, but we've been hearing again that's being pushed out a little further, so more like 4 weeks before you're going to receive that. So now you've completed step 3B. So we're going to move on now to step 4. Now step 4 is entering the SAM's portal. So once you successfully have registered with the SAM's and provided all that identity verification, documentation, your firstborn, your everything that they want, because that's how it feels with the questions. Don't feel bad about that. Everyone is being asked that question, so you do have to provide it if your intention is to have a SAM's card and have access to NHSN data within your data for your facility. You will then receive an email indicating your registration has been approved. So in order to access NHSN, you must now first log into SAM's using the newly obtained grid card, which takes, again, that probably is going to take 3 to 4 weeks to get to you, and your username and password. You go to the website below, the link below, click on that, and this time, when you sign in, you're going to use your card, so you're going to use the middle section, because it's SAM's grid card credentials, because now you have that. You have the credential in front of you, you hit login, and then you proceed from that point on. So once you've done that and you've gotten in, you're going to come to a screen that shows Select NHSN Enrollment to submit your facility's contact and survey information. So if you see, when the screen comes up, it's going to have 2 things. NHSN reporting, and then the second one, NHSN enrollment. So For this first time, you're going to click on the arrow that says NHSN Enrollment. So, step 4C, Access Enrollment Form. If you have not already printed out the copies of the facility contact form and the annual facility survey, which I talked to you about on slides 11 and 16, then click here on Access, where the red arrow is, Access and Print Required Enrollment Form. And I'm assuming I suggest that before you even do this, you have those forms all completed, and you give yourself a good hour to do this, because these forms must be completed prior to entering the information electronically into NHSN. So you will enter under the long-term care facility component. Then you would click, after accessing, printing, completing, and requiring all those forms, you hit the enrollment facility on this site. You must complete all of the data submitted about your facility in one session. There is not the ability in this particular module to pause, save, rewrite, do anything. You have to complete everything. I guess you can correct things within it if you enter a wrong number, but you have to do it in one session. You cannot save the work in progress, and so be prepared to do it from start to finish when you make the decision it's time for me to enroll in my facility. So what you will need is your facility contact information. All of the fields that have a red asterisk must be completed in order to save your work and in order to complete this enrollment process. So please make sure before you hit the button to save that you have completed all those mandatory fields. Facilities which are CMS certified should, as I told you before, have a CCN number. Those that can't find out or don't think they have a CCN number, you have to contact the NHSN Help Desk, and they will help you from there. Facilities within the Department of Veterans Affairs, and I don't know how many facilities out there are those type of facilities, you may have a VA station code instead of a CCN number, and that would be what you would be using. So you select the most appropriate facility type. So it's very clear at the first arrow, what is your facility type? Are you an assisted living, a residential care facility? You would click LTC Assist. If you are a facility caring for individuals with developmental disabilities, you would click LTC DEVDIS. And if you're a skilled nursing facility or a straight nursing facility, you will click LTC Skilled Nurse. And then you would move down to the components where, as I spoke to you before, the component you will be using for this CDI project is long-term care facility. However, you do have the opportunity at this point to also click off health personnel safety components if for some reason you want to enter your healthcare worker vaccination data into that component. Now you select the component in which you've said that already. The NHSN Facility Administrator is the person enrolling the facility. Now remember, use the same email address as I told you before in steps 2 and 3. Moving on. The long-term care component enrollment requires a long-term facility contact person. This is the person who will be most involved with the long-term care facility surveillance. It can be the same person as the facility administrator, or you can name someone else. But whoever you name in here will be who NHSN contacts with any issues with NHSN. They will get the emails, etc. Now you've completed all the fields. Remember, you cannot partially complete the form, save it, or return it. You have to do it in complete format and then save and return. So, submitting the forms electronically. Once this information has been saved, you will get this little green check. And this is, take that into consideration, because throughout the whole process, when you do something correct in NHSN, they always give you the little green check in the box when you completed something. And at this point now, you would get the green check that says the long-term care facility survey has been completed. So I would suggest that at this point you also click on Print Completed Survey, because then you will have it as a backup. Once you've done that, you also have to click Save and Submit, or it will not be submitted. So don't forget that. Again, there's all these buttons at the bottom of all these screens, and always remember, Save, Submit, Save, or whatever. Once the required forms are submitted, confirmation message is displayed. So again, you get that little green check mark that says you did a good job, the enrollment for your facility, blah, 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 with the tracking number of has been completed, and the facility administrator will receive an email with further instructions. If you don't receive this email, please contact the NHSN Help Desk. And this is another thing. This NHSN Help Desk is your only way of communication with NHSN. There are no phone numbers. You do have to use nhsn@cdc.gov. It took me a long time to get used to it because I wanted to have a phone number where I could pick up and talk to them, but this is how they do business, and they do answer you quite frequently. We've learned this week that they really were answering like within an hour or so, some of our folks that had questions. So now you've completed step 4. So now we move on to step 5. And that is sign and send consent. NHSN email, subject line, NHSN Facility Enrollment submitted. Link to your consent form. Consent forms are facility specific, and you must print the consent form provided in that email link that your facility administrator receives. You have 30 days to open up this link and print it. So if your facility administrator is going on vacation for a long time or on a leave, and someone else is going to be responsible, I would suggest that you either give them access to this or have that person able to get into their email, because the link only is active for 30 days. So once you click on it and you open the link, you must print it, and CDC must receive it back to them in 60 days. So within that signing and send consent, the agreements to participate and the consent is included. And also within it is the NHSN purposes, eligibility, date collection, and reporting requirements, and assurance of confidentiality. You must sign all of these forms. The long-term care facility contact person who you designated on slide 36 should be signing this, and your facility leadership. It requires signature from the highest level of administration at your facility, along with the long-term care facility contact person. So you sign them and you send these consents in. And within 2 to 3 business days after NHSN receives the signed consent form, NHSN will activate your facility. The NHSN Facility Administrator will receive an email notification of facility activation from NHSN, and it looks like this at the bottom of the screen here. So, now you have successfully registered and your facility is now approved to report into NHSN. Enrollment is complete. The next step is for NHSN setup. Setup training for the NHSN long-term care facility component is available, and we have decided that next Wednesday we will be doing that piece of the NHSN. It will discuss mapping, adding users, and creating the monthly reporting plan. Setup is required before you can do any data entry or reporting. So this is just a suggestion. The NHSN has created this enrollment timeline. So it is quite a time period from beginning to end before you are ready to put any data into NHSN. About 7 weeks total. So email is your only way to communicate with NHSN. This is and they will communicate back to you only in email. So please put this email address, in your favorites so that you will remember it, because this is your only way of communication with NHSN. Where can I find more information about enrollment? The NHSN website is a wealth of information. You can email questions to the help desk. Just for general enrollment resources, you can look at this website on the right. And then there's long-term care specific enrollment and reporting resources. That's always also on the right. If you ever have a minute to really play around in this website, it has a wealth of information. It has brochures for your families. It has posters that you can print out. It has toolkits. It has just about anything you might want. And every time I play around in it, I find something new that I think, oh, I can use that. And why recreate the wheel when it's already there? The other thing that is also important is that the NHSN site itself, once you become familiar with that, I will suggest it. I learn something new every single day I go into that website, and I've been doing this probably now for about 6 years. So don't be afraid. You're not going to change data around, looking in the website, playing around. It just gets you familiar with stuff. So now we're going to open up the lines to any questions. Again, here I want to tell you, this is your Bible, the enrollment checklist. Follow it step by step, and you will be a successful NHSN enrollment person. So, again, next week, 11 to noon, we're going to have the September 21st, the facility setup webinar. But right now, we'll take any questions. Nellie, are there any questions in the chat?
Yes, we have one question. It's asking if an invite or an email has been sent to enroll on next week's webinar regarding NHSN.
Today. We have not sent that out yet. It will be being sent out today. We kind of we thought we might be able to fit everything in today, but then when Janet and I had a conversation, we thought it was maybe a little bit of overload for you folks, and we thought we'd separate it into 2 sessions.
And this is Janet now. First of all, Maureen, I want to thank you for that very detailed walkthrough of the enrollment checklist. We have found in working with our facilities that people really seem to need the real step-by-step instruction on how to do this. For those of you who do have questions, you can unmute your line by pressing #6 to ask us a question. We're ready.
Next question, how can we get a printout of today's slides? They will be sent out in an email today with the evaluation of today's webinar. Unmute your line, *6.
#6. #6 to unmute your line to ask a question. While we're waiting, there were just a couple of things that I wanted to mention. We have learned in the last couple of weeks that the NHSN help desk has become more responsive. There was an issue just yesterday with the facility. They sent an email to NHSN, and in less than 5 minutes, they had an answer. And I want to describe what that problem was, just in case some of you also come up against this. This particular facility had their SAMS card. They logged on to NHSN to enroll, but the NHSN enrollment option was not there. It only said NHSN reporting. And after a couple of tries, and the facility called me, they sent a message off to the NHSN help desk, and within 5 minutes, there was a response. It was a problem at NHSN, nothing the facility had done wrong, but it was corrected very quickly. The help desk did advise the facility to wait a few hours before trying to enter the data again, so there must have been internally, there must be some type of lag when they make a correction before it catches up with the actual system that's going to be used. A couple of other hints. When you are doing your identity documents for your SAMS card, make sure that all of your identity documents have the identical name and address. So you have to provide 2 pieces of documentation. If name and address do not match exactly, you will be asked for further documentation. You're looking for proof that you are who you say you are before you're going to have access to data in this federal system. And one last item related to SAMS. It is important in item 3A that you put in your personal home address, not the address of the nursing home where you are working. Again, they want to know who you are personally, so you do have to use your personal home address.
And that the card gets mailed to the house.
And the card will be mailed to you at your personal residence. Do we have other questions? Again, #6.
Yes. We have one other question asking, is there another way to receive the webinar on September 21st? They have a conflict at that time.
A recording of today's webinar and next week's webinar will be available on our website, healthcarefornewengland.org/events.
And also, if it's just one facility that has this problem, we can do a one-on-one with you to walk you through. Anytime, if that is how you feel, we can do one-on-one. Oh, and let me give you there's everybody, the individual state leads. And I also I'm not on here right now, but in the beginning I was. If any of them are not available to you, I certainly can help if I have time available.
We have another question from Angela. I have been trying to log in to upload my identity verification documents, but I have not been getting an error message saying access request failure. You have attempted to access a resource that does not exist or for which you do not have an authorization. Please double check your request and try again. I called SAMS and they said they couldn't help me, that it was an NHSN issue. I was instructed to wait a day or two, but now I can't even log in. Should I call NHSN or SAMS for this problem?
Angela, this is Janet Robinson. Actually, Danielle, your contact person in Maine, contacted me this morning about your concern. And I provided her with a name and an email of someone who may be able to help. I think that the NHSN Help Desk has contracted to have more help available to them. So I did have one name, and I believe you can check with her after we're done talking. But I believe that Danielle sent your question to this particular person, and we are trying to resolve that for you. My other suggestion was, when I read through your email, it sounded like it might be a SAMS problem, and I understand you didn't have any luck with them. Going forward, I would suggest to everyone, if you're having any difficulty getting an answer, send your question to the SAMS Help Desk and the NHSN Help Desk. And if you send them both at the same time, you'll have covered two bases and may increase the likelihood of getting a response. But again, for your particular situation, please check with Danielle after this recording because she and I did speak this morning about it.
And the only other thing that I just thought that might help you is that there is a refresh box on your email. If you hit that, or the little piece of paper that's broken, that looks like a ripped piece of paper, sometimes hitting that refreshes some of the information within the NHSN database and may correct everything for you. I'm not saying that's a solution, but I know in the past that's what they told me to do because things weren't going quite right. And it just refreshes the screen so it works better. And again, if you're getting into it at least somewhat, I would say just make sure there's no blocks on your computer and have IT look at that. It could have something to do with the way they encrypt things. You can't accept them or whatever. So I would just maybe suggest that too.
And for everyone's benefit,
and to stand, right? Someone trying to talk?
It looks here like Danielle Watford said that she did follow those steps.
For everyone's benefit, on the enrollment checklist, at the top of the checklist, you will see the email for the NHSN Help Desk. In the middle of that first page, you will see the email for the SAMS Help Desk. I also do have, although there's no phone number for NHSN, there is a phone number for SAMS Help, and that phone number is 1-877-681-2901.
We have one other question.
Could you just repeat that number, please? 1-877-681-2901. And we'll also put it into chat.
And that's Sam.
Next question. Yes. What about the second identifier if it has a different name, say a maiden name? Will they be asking for a marriage license? My second ID will be my birth certificate.
Yes, they will be asking for some additional sources of identification. I do not have that list in front of me, but when you go through the SAMS process, they actually clearly lay out primary and secondary forms of identification, so the information should be there for you.
No other questions at this time?
Are there any other questions that you would like to submit at this time? We all appreciate the additional work that all of you are doing in order to enroll in this, but I truly believe that this will be very beneficial for your facilities down the road.
Excuse me, I'm sorry, I couldn't get off unmute. I do have a question.
Go ahead.
All right, so my second ID is going to be my birth certificate, which has my married name on it. I mean, my maiden name on it, sorry. Are they going to be asking for, like, should I just submit it all in with, like, my marriage license so that they're not asking for stuff and get delayed?
So you're saying should you submit 3 forms of ID just so that everything is covered? I don't think that's correct. Have you gotten to that process yet where you have the list of what is acceptable for identification?
Yes.
In that, I don't have that paperwork right in front of me, but I think there were 2 lists, primary and secondary forms.
Right.
So I would go with what is on that list. If you're going to submit 2 and they don't match, they will ask you for more information. So I don't think it would hurt to submit 3 right away so that there would be proof of who you are. Believe me, if they're not satisfied, they will let you know and they will tell you exactly what they want you to send.
Okay, thank you.
Are there any other questions?
To ask a question, you have to unmute yourself, so press #6. Hi, Janet?
Yes.
This is Lisa over at South Kingston. How are you?
Hi, Lisa. Nice to hear you.
I have a quick question about the in-service for next Wednesday. If we're going to attend it next Wednesday, but we're not at that part of the process yet, are we going to get copies of those slides as well?
Absolutely.
Okay, perfect.
Yes.
Thank you.
And again, when you get to that point, if you feel you're a little leery, you can always give us a call.
Thank you.
Any more questions?
If there are no more questions, I would like to thank everyone for a great discussion. I have a few last announcements before we end, and while I'm talking, if anyone has a question, you can still do that. When you do close out of the webinar, an evaluation will automatically pop up on your computer. If you could fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or if you're currently sharing a computer with someone else, you will receive an email tomorrow morning with the link to the evaluation, as well as the link to the event page on our website. Today's presentation is posted on our website, and within the next few business days, a recording and a transcript will also be added. And in closing, one last time, here on the slide that you can still see, please note that your state contact is available for one-to-one assistance.
And one thing, this is Maureen, that I did not mention to you that you might be interested in. We thank you extremely with all our hearts and souls on that you've signed up for this, because you are the forerunners. What you will be doing for the long-term care facilities by entering your data into NHSN on C. difficile, you will be setting the baseline for the rest of the nation when this rolls out to everyone. So we thank you again for offering up your facilities for this task, because we know this little piece is monumental to get on. It's probably going to be the most work you do in NHSN, because the data submission is extremely easy. Thank you again.
We look forward to being with you again next week. Thank you very much.